ourselves a chicken, we can watch the farm show.
Welcome to the Farm Show. Tonight's guest is furosemide. Y'all know what time it is. Here's your host, Polly Pharmacy.
Thank you, everyone, and welcome to tonight's episode of the Farm Show, where we go in depth to discover medicine's true nature. Please help me welcome to tonight's guest, furosemide.
Woo! Yeah!
Watch out, Polly. It's getting scary out there.
Thanks for having me, Polly. I'm really overwhelmed to be here.
So when we were getting ready for the show, I heard one of your friends call you Lasix. Is that a nickname?
Oh no, Polly, that is my commercial name. Most people would know me as Lasix, but my generic name is furosemide, and that is what I prefer to be called.
Well then, I guess I'll stick to furosemide then. So tell me a little bit about what your family is like.
My family, the Mides, are known as loop diuretics. It's scary out there, Polly. For the most part, we share the Mide suffix with the exceptions of a couple of black sheep. We all basically work the same. However, I am the one most prescribed.
So what is a loop diuretic and how do you work?
We're called loop diuretics because of where we work. The main purpose of our use is to block the reabsorption of sodium and chloride from the loop of Henle in the nephrons of the kidneys. By blocking reabsorption, I can prevent the passive reabsorption of water and produce profound diuresis. I make it rain, Polly!
You make it rain?
Yes! Polly, patients who take me make a lot of water, have to drain the main vein, see a man about a horse, frequently.
I see. Tell us more.
Well, I'm administered orally or via IV or IM injection. With oral dosing, diuresis occurs within about 60 minutes and lasts for about 8 hours. IV therapy is used in critical situations that demand immediate mobilization of fluid. I undergo metabolism in the liver and I am excreted in the urine.
Wow, so what exactly does that mean? What exactly is the reason for your use?
I am used when massive or rapid mobilization of fluid is required. Generally, that involves pulmonary edema associated with congestive heart failure, edema with hepatic, cardiac, or renal origin that has been unresponsive to other treatment, and hypertension that cannot be controlled with other diuretics. I am especially useful for patients with severe renal failure because I can promote diuresis even when renal blood flow and glomerular filtration rate are low.
That is impressive, but can't massive fluid shifts cause problems?
That's correct, Polly. Anytime large amounts of fluid leave the body, electrolytes go with it. I can potentially cause hyponatremia, hypochloremia, hypokalemia, and dehydration. I can also cause ototoxicity, hyperglycemia, hyperuricemia, and unless it is absolutely necessary, I should be avoided by pregnant women.
I guess that is to be expected. Is there anything else you'd like to mention? Like perhaps drug interactions?
Somehow I knew you were going to bring that up. Digoxin and I are not friends. That's the one who's throwing rubber ducks. And combining me with hypertensive medication or ototoxic drugs can increase my adverse effects. NSAIDs and I tend to work against each other, and people on lithium should be monitored to make sure their lithium levels do not become toxic.
I knew there was more. Well, thanks for sharing all of your information with my viewers. Do you have any final words?
I am an extremely powerful drug that is generally reserved for situations that require rapid or massive mobilization of fluid. This is a risky business that can cause hypovolemia, acid-base imbalance, and altered electrolyte levels. So patients should be closely monitored when I am prescribed.
It sounds like even with your adverse effects, you are still a beneficial drug. Thanks so much for coming to the show, furosemide.
Thanks for having me, Polly. Bring on the rain!
This has been the Farm Show, brought to you by Team Ramrod.